Good morning, Mocha Latte 75. Welcome, welcome. Hi, Fatima. Hello. Keep her Mijin. Hello, Sierra Cloud. Nice to see you. Embatonez. Nice to see you. Monton Friend. Amber. Nice to see you. Amber again. Teddy. Hello, hello. Welcome to my Facebook Live and YouTube Live and my Instagram Live, and we're all live here. I set up my computer a little bit differently. I hope this helps everybody to see me a little bit better. I'm going between a couple of screens, so you'll see me turn from place to place looking at the questions. Hello, Maria. Maria times three. Well, that's a lot. There's three of you there. Nice to see you, Nicole. So today we're going to be talking about mostly questions and answers. However, I'm going to talk about one slide. So all of you who want to jump over to Facebook Live and YouTube, I have one slide up, and I'm going to be talking about the optimizing the follicle sizes to get mature eggs, normal embryo, more normal eggs, and blastocysts. A lot of questions are, hey, hello, Travel in Harmony. Good to see you. Mrs. Penelosa 10221. Nice to see you, Melissa Voss. So I'm going to be talking about the follicles from an IVF cycle and what sizes you may want to have to optimize the greatest number of mature eggs, greatest number of blastocysts, and the greatest number of euploid. Now, there's a lot more information in there, which I can certainly talk to you guys about, but I think those are the three main things. And then I'm going to jump into question and answers and that kind of thing. Hi, Rochelle. Nice to see you. Of course, my pleasure for the chat. Oh, Amber Vance, nice to see you. I'm doing great. Vanessa Rodriguez, hello, my dear. And again, you folks, if you want to join our CNY Fertility member group, please do. We love to see you in that group. Hello from Houston, Hector. Good to see you. Ebony, hello. So all you folks who are currently on Instagram, you can stay on Instagram, or you can jump over to Facebook Live. Like I said, for about 10, 15 minutes, I'm going to show you some information about follicle sizes and when you're doing IVF. Another way of saying it is, when should we hit a patient with their triggers to get the optimal outcomes? And there are now answers. It's a brand new paper in press. It's not even out yet in the American Society for Reproductive Medicine's Fertility and Sterility. And as you know, I love giving you guys lots of information. So you can go to Facebook Live, you can go to YouTube Live. Hello, Glenda. Hello, Steph 2823, Yamil 2006, D Trip, welcome. Hi, Prolactin, Stephanie 2823, Ashley Colorist. I'm going to be answering questions after I talk a little bit about follicle sizes in IVF to get the maximum number of mature eggs, the maximum normal eggs, and of course, the most blastocysts. Okay, love the kisses, as you very well know. Hi, folks. Looks like people are jumping over to Facebook Live. Stephanie, nice to see you. Sherry Lynn, Rick, Quell, Rice, good to see you. Glenda, again, good to see you. Will you please talk about different protocols? Razin, Razin, I have talked about the different protocols with you every single week. And then I also have in my Facebook Live catalog, there's a whole discussion of low ovarian reserve, the mini protocols. I've also done a whole section on how to understand protocols, so check there. Necklace and glasses combo. You loving it, huh? My new glasses? Me too. I like my new glasses. These are like Oakley. I got them at my local store there, and I always wear my little necklace here. This is just a gold chain. I'm trying to take after Dr. Kills, who always wears a gold chain. Mama Mancini, nice to see you. Lita Bug, nice name. The Carolee Baker, hello. A glimpse of a diamond. Peachy Frank, nice to see you. So let me have you guys. You guys are on Instagram. Just jump over to Facebook Live. As I said, I'm just gonna put up one slide and I'm gonna talk about it. Hello from Minnesota, Carly May. Let me throw this up here. Let me make a big image here. Facebook Live and YouTube. If everybody will jump over to Facebook Live and YouTube. This is a simple graph. It's from a publication in press, so it's a publication that has not come out yet. And specifically, I want you to look at the various, it's a histogram, so you see these little columns. And on the top here, I've put the size of the follicles. The follicles in the first one column is less than 10 millimeters when they're hit with triggered, then 10 to 12 millimeters, 13 to 15 millimeters, 16 to 18.5 millimeters, which a lot of the literature talks about. Then the middle is 19 to 21 millimeters, 22 to 23 millimeters, 25 to 27, and of course over 28. So there's a pattern here. And what I want to specifically talk about is when we do an IVF cycle, we say it's an 11 days of stimulation. And during those 11 days, we then we watch the growth of the follicles. What are we looking for? Well, we're looking for a certain mean diameter. So the mean diameter that most folks talk about in the literature is 16 to 18.5. And that is what they consider to be the best size for the follicle to get mature eggs. But, you know, like in anything else, what we think and what are reality are different. And so many studies, and my own experience included, have looked at this, and what they found, and I'll look at the mature eggs, what they found is the larger the mean diameter of the follicle, so going from 10 to 12 to 14 to 16 to about 18, 19, you'll see that's the peak number of mature eggs. Now, what you'll also notice is that even at 19 to 21, 22 to 24, you get approximately the same number of mature eggs. And then as it gets a little bit beyond that, 27, 28, you know, you sort of get fewer. So you don't want to grow out that far. But the good news is that even if you have some that are 26, 27, you can get mature eggs. You know, and the rate at which you get them is about 50% of the follicles will have mature eggs. Now, so what this says is that when you're doing an IVF cycle, you want your follicles in that 18 to 20 range. That would give you your sweet spot, right? So if this is the 10 to 12, 13 to 15, if you can see my little arrow there, I'm down here on the bottom here, mature eggs, 13 to 15, 16 to 18, 18 to 19 to 21, and then of course 22 to 24. So growing them beyond 16 certainly would give you the best chance for getting mature eggs. Now, what about of those eggs that you get, what is the chance that those eggs would be euploid or normal? And what you find is kind of an even distribution. It's not really linear. No, this does not change with age. This is really looking at the broad brush of patients from probably 18 to 42. I can get more specifics later. But what you notice is that euploidy rate is not a function of the size of the follicle. So honestly, you're going to get normals from anywhere from 10 millimeters that are going to be chromosomally, if they're mature, they're normal, and up to even as high as 28. If they're mature, then they're normal. And a little bit of variation here. And now, of course, that can even out, and you'll probably see pretty much a straight line here. But what was interesting to me was blast formation rates. What you find is a linear increase in the production of blastocysts, which is the stage of the egg or embryo that will implant into the uterus. And by the way, the ploidy, of course, is an embryo, not an egg. I misspoke. So this is a euploid embryo. And then this is a blastocyst. And what you notice is as the follicles get larger and larger and larger and larger, you get more and more, proportionally more blastocyst formation. And of course, blastocysts are what the type of the embryo, which is the stage at 5, 6, or 7, in which you get the implantation. So why I bring this to you is I get lots of questions. Dr. Magarelli, why do I have so many immature eggs? Dr. Magarelli, can my follicles be too big for me to get eggs from? Dr. Magarelli, is 24, 25 too big for a follicle to get eggs out of? So to answer that, you can get mature eggs up to a size 28. However, the ideal proportion of eggs retrieved is in that 19 to 21. For euploidy, it's really doesn't matter. It's a function of many more things than just simply the follicle size. But in terms of the eggs that you get that will turn into embryos that become blastocysts, what you see is that as you increase the size of the follicle that you trigger, then of course you get a higher blast formation rate. So it was simple. I thought it was very interesting. I think this will allay a lot of folks' fears in that some people think, oh, my follicle is too small to get matures. Nope. Oh, my follicle is too big to get matures. Nope. My follicle is too small to get a normal embryo. Nope. My follicle is too big to get a normal embryo. Nope. Is there an ideal size for us to get the optimal number of mature eggs, euploid, and blastocysts? I think pretty much that's going to say in that 19 to 20 range, certainly 18 to 20 range, 18 to 21 range. That's where you're going to get your ideal eggs, euploidy, and blastocysts. All righty. Anyway, I thought that was interesting. So what's the sweet spot for triggering? I would say 18, 19, 20, 19, 20, 21. So 18 to about 21 is the sweet spot. So let me close this here so I get my face back on here. Okay, so we're back. All righty. So now we can open this up to questions. If my larger follicles are 18.5 on both ovaries, I only stimulated for 6 days. Out of the 17 eggs, only 7 more mature. Should I have stimulated a little longer to get more mature follicles? This data would say you certainly can, even up to 19 or 20. Jasmine, if 2 days, by the way, Jasmine, we did hire that lovely MA. She's so happy, and I told her you wanted me to hire her, so thank you for saying that. If 2 day 3 embryos implanted around what HCG levels should be? There's no shoulds. I wish I could give you a number as to what they would be, but there is no shoulds. Does the follicle contain only 1 egg? Yes, but not all follicles contain any eggs. So what we're excited about is or what we like to tell you is that we like to see about 70% of the follicles contain eggs. Does the data come from medicated or non-medicated cycles? Totally IVF medicated cycles. That's what this is. This is IVF medicated cycles. Diminished ovarian reserve and low AMH. You have to give me a question, Jamaica Miller. Give me a question. Chelsea, what thickness do you expect or like to see uterine lining at baselines? Too thick to, baselines and transfer are not the same thing. So at baseline, we like it less than 5 or certainly less than 5 millimeters. Transfers, we like it ideally around 10, but it can go anywhere from 6 to 17. A glimpse of diamond. If I only have 1 ovary, how successful will IVF? To me, it has nothing to do with how many ovaries you have. It has to do with how many eggs and how old you are. I'm 35 years old. I have 3 embryos. First time transfer. How many should we transfer? 1. This is traveling in harmony. Okay. If you have fibros, does this affect the eggs? No, not at all. Amy Pope, 43 question marks. What are you asking? Please ask short questions, but ask a question. Overstimulated ovaries, how do they impact IVF? Actually, not so well. Number one, you're going to get more eggs typically, and you may have to do a frozen transfer. But in terms of the egg itself, no problem. Sherry Rickwell Rice, I had my egg retrieval on the 23rd, prepping for FET. Wow, 6. You still had a 17 millimeter follicle. That doesn't mean that won't affect anything. Julie, I have 8 abnormal embryos. I've decided to transfer. How many should I transfer at a time since they're not likely to stick? 1, because remember, if you transfer, they're all abnormal. Well, then the likelihood of implantation is low, so possibly 2. Is it possible to do fresh transfer with PG testing? No. Do you recommend PGTA testing? Not specifically. I'm flying out to Colorado for my egg retrieval and fresh embryo transfer. How soon from egg retrieval do you recommend getting to my destination? 2 days. Letitia, hi. I have the Zero Vital multivitamin pack. Is that okay? Well, I like the cheap one. Don't get that multivitamin pack, Letitia. Just get the cheap one. And unfortunately, it also has some caffeine in it. I don't think you'll be harmed, but just get the inexpensive one. Amy Pope, I'm 43, thinking of coming. People say I can't due to age. Yes, people do say that, but we do not say that at CNY. When should I get a phone call from the nurse team after initial consult? Well, you should have called the financial team first, Sarah. Then after you talk to the financial team, you should call the nurse team. Yeah, no one's going to call you. Jamaica, ideally, what's the best route? Whoa, too many questions too quickly. I'm going to have to start at the end here. 39 with 2 day 3, 1. How many should I transfer? Day 3s, 39, 2 should be fine. Sherry Lynn, are intralipids and HCG wash done the same day? Yep. As a transfer, no, before. Beth, 43, did 2 egg retrievals, but no PGTA. 6 eggs now with CNY, not doing PGT. I'm going to hope anything else to do better. PRP, best time to do the PRP is the month or 2 before your cycle. Rochelle, what are the thoughts on DuoStim? I think it's excellent. Beverly, for transfer, what's the maximum thickness lining preferred? Well, the ideal lining is 10, but it can be anywhere from 6 to 16. Easy way to remember it. Great accent. Whose accent? Do I have an accent? I don't know if I have an accent. Ellen Joe. Okay. I'm supposed to have my retrieval Monday with a lead follicle at 19, but my LH surged between Wednesday and Friday, so they canceled my cycle. Should we have done the retrieval sooner? Well, again, yeah, I'm a little lost there. It's a little too complex. 3 day 3 fresh transfer is better than 5 day with male factor. Is day 3? No, day 5 is always better from the data. Vanessa, if you haven't joined us at the CNY Fertility Member Group, please do that. Please do that. Please do that. So join the group. There's 3 with the exact same note. Gotta love Savan. Welcome. Travel in Harmony. Giving me, it looks like a star kiss. Okay. Vanessa, your information is repeating. But Rodriguez. So, yeah. Hi. Amanda. Hi. We'll be there tomorrow for baselines for low dose stims this round. Can you explain how letrozole helps in a low dose stim? It saves you money. What do you think about improving egg quality with CoQ10? I think there are some interesting data that suggest that. Is it possible to do a fresh transfer of Phamecia? I gave you the answer already, which is no, it is not possible. Is it normal to not have bloating during stims? Yeah, you don't have to have bloating. A glimpse of diamonds. I'm 28, have PCOS, never been pregnant. I'm looking to start IVF soon, but I'm concerned because I only have 1 ovary. No problems. It's eggs that matter. How many eggs should I expect at 28? About 8, normally 15. If a man has a vasectomy, would we need donated sperm? Amy, no. We can actually go to the testicles and get the sperm. It's called the TISA, PISA, MESA, PESA. Okay. Is letrozole better than Clomid? Nope. I'm 46, almost 47. Nope. Not in your circumstances. Hello, Mrs. Quadrant, Fertility Nurse Lee. Hello there. Hi there, Ali Unnatural. Okay. Zymot recommendations for severe male factor. I don't make recommendations on Zymot. But if you like it, we're happy to help. Jamaica, diminished ovarian reserve, low AMH. I've done 4 cycles, 2 embryos. What's the best route for me? Donor. Donor might be the best route for you. Nicole, thoughts on Gonalef for someone with PCOS and trying regular intercourse? It's risky, but you can do it. I just wanted to know how amazing you are. Okay, you called me up for a retrieval in Colorado to give me an update with embryology and talk to me like you knew me well. I didn't get that kind of treatment at my local clinic that is one of the top 10 in the nation. Thank you for your kindness, your empathy, and treatment like a human being. This is Christina Maria. Thank you so much for saying that. That's very sweet of you. Fertility Nurse Lee, Dr. Mag, happy Tuesday. Global Travel reaches out to all the patients within 2 to 3 weeks of their initial consult, and we can't wait to wait with you. We can't wait to work with you. So where's my water? Oh no, I didn't bring my water. Okay, so I'm going to be dry, folks. Anyway, thank you, Fertility Nurse Lee. I'm not sure if you're seeing my question. What do you recommend? But But do you recommend LDN with a protocol? Not necessarily. Oh my God, I'm so excited. Okay, good. Started. Okay, going by too fast. Okay, Vanessa, we're getting a lot of these join CNY fertility member things. Try to let just maybe every few minutes. If I have a cyst on my ovary for my baseline, do I need to wait until that it's gone to start IVF or take birth control pills? It could be either one, Yamil. Can take Serovital? Can take, yes, we should take Serovital, the least expensive one. So I'm going to go jump back to my little slide here in case you guys are just joining, because a lot of people seem to be just joining. And basically on this slide, I'm talking about the follicle sizes that are ideal for, hang on a second here, let me get this set up for me, that are ideal for retrievals. And what I basically said is that you can get mature eggs from follicles that are as little as 10 millimeters to as high as 28 millimeters, but the ideal is about a follicle that's 12 to 21 millimeters. You can all see this, by the way, on Facebook Live and YouTube. For euploid embryos, it's not really size specific. It really isn't. I didn't do this one up here, but here you see good blastocyst formation rate again at that 19 to 21. But also you see that good blast formation by oocyte. You can see that as the follicle gets larger, you get more and more blastocysts of a certain quality, good quality as they define it. And again, I'll get more information on this, but I thought this was a brand new study. Everyone asked what size you should get your follicles. So the ideal is 18 to about 21. The smaller, of course, the more immatures you get. Larger, it suggests here that you may see a little slight decrease in the number of mature eggs. In other words, they may be post-mature. So you kind of want to get into that 18 to 21 size. All righty, I'll bring you back to me here. Okay, here we go. Maybe I can do it this way. Yeah, I'll do it this way so you can see that in the background there. All righty, what's new at the Colorado location? Any new protocols for COVID? Anything new going on with the COVID faculty or embryology? My CMY baby is 4 months, so I'm out of the loop. Well, we're up to 52 staff members. We have 2 doctors. We have a wonderful nurse practitioner, Brandis. Brandis is now doing embryo transfers like a champ. She's phenomenal. We've got some new nurses. I think we still have the same embryology team, which is about 7 of us. We just hired some, and we are looking for new nurses because we're growing. We just hired some new lab tech folks, front desk folks. So, yep, lots of stuff. All right, Kim Ann, I'm 37, AMH 1.7, finished my first retrieval, 10 eggs, all mature, fantastic, 9 furred, 5 blasts, 1 normal. Estrogen was 2700. We're about to start round 2, suggested possibly increasing the menopure dose to 300 to keep increased number of eggs retrieved and chance for more euploids. That is right. What are your thoughts on menopause dose that high? I worry about the affecting quality. I will have to do it again, that the dose of the medicine does not affect egg quality. That's old data, not supported by the literature. Vilma, thank you so much. Loving your lectures. We need a lecture on prolactin because read a study that slightly elevated prolactin has a better IVF outcome. Yes, as a matter of fact, I've certainly read those studies way back when, but where there's nothing you can do about it. You can't give prolactin. Is there anything that I can take to get more eggs in a natural cycle? I'm not sure what you're asking. Your body has a plan to allow you to grow 1 egg at a time. 1 egg mature at a time. That's built into your DNA. Does weekly acupuncture help with egg quality leading up to retrieval? The suggestion is that it produces better blood flow, which gives you more access to eggs. We do see better outcomes, fewer miscarriages, more take-home babies. So it suggests that it may. So you want to get, Nikwa, you want to get at least 8 to 10. It's called the Credenda Magarelli Acupuncture Protocol, started by Dr. Credenda. from East Winds Acupuncture. She's here in Colorado Springs. And folks, if you are coming from out of town and you want Dr. Credenda and her team to help you, go online to eastwindsacupuncture.com, because they have a lot of patients, so we want to plan ahead. So plan ahead. What is PRP? It was recommended. Well, platelet-rich plasma is your own plasma, which they use to find platelets, and growth factors, which can help with increasing potentiating the eggs that you have, and access to those eggs. Also, you can use it, so you could do that intra-ovarian, and there are some studies which show that it can actually rejuvenate the ovary. The other place people use the PRP is you can wash it inside the uterus. And what that does is, again, like a growth factor, it helps the uterine lining produce optimize and produce the best lining for the implantation. So 2 ways PRP can be used: intrauterine, or it can be used in the intraovarian. Kia, love. I don't get a cycle still. Can you do IVF if you don't get a cycle? Well, it's the reason why you're not getting a menstrual cycle that we have to figure out. That's the first thing. So do testing. Hypnotherapy for fertility. This is Brandy Wiltsey. My thoughts. Well, I met some folks who swear by it. But again, I don't have any research, and I'm kind of like a research nerd. So yeah, I just don't have a clear yes/no answer. I don't think it'll hurt. I think there are lots of things that can block folks, so I don't think it'll hurt. Stars 77, Lacey, hi. Chloe's baby journey. I've seen you before. Hi, good to see you. Okay, so this is Dr. Magarelli, CNY Fertility Colorado. Giving you my weekly live. Peachy Frank, I saw your name. After doing a transfer, what kind of diets can one be eating to improve the chance for pregnancy? Well, it's a low carb, moderate protein, high fat. What is moderate protein? What is moderate? A low carb, less than 50 grams a day. I would like to know what the likeliness of Asherman. See, Ellen Joe, I don't understand your question. I would like to know what the likeliness of Asherman syndrome transfer is. Oh, the success rates. No one can tell you that. No studies have been done. The efficacy of Receptiva if 0 symptoms after 3 failed PGTA. So Receptiva is a test on that looks at inflammation, or as a marker inside the uterus, like endometriosis, fibroids, or inside the pelvis. So that's what it's really checking. It doesn't tell you you have endometriosis, but it can suggest that you do. I think it's worth doing the test. Do you think uncontrolled diabetes and male factor causes infertility? Yes. Do you recommend having progesterone suppository and injections at the same time? Yes. Any new studies available on egg quality and IVF success for cancer patients? Not that I've read recently. Is an AMH of 0.1 okay? Yeah, it's low ovarian reserve, but certainly we've gotten eggs from folks like that. Angela, I did baselines. I have 3 monitoring appointments scheduled. Should I expect to fly out to CNY shortly after the 3rd monitoring appointment? Not really. It's closer. Well, yeah, if that's the last monitoring appointment on days 8, 9, 10, 11 of your stim, yes. Hazel-eyed chief. Okay. I had my transfer today. I just came back from Albany and I transferred 2 embryos and I'm excited and praying for positive. Well, let's all pray with her. Okay. God, I sure wish I had my water here. Okay. All righty. Any more questions? The B World joined. Hello. So again, this is Dr. Magarelli, CNY Fertility Colorado. I'll give you, do you give nurses a discount? Nope, we give everybody a discount. That is what we're famous for, which is our fees are now, I hear, 8 times less expensive than San Jose, California. In other words, our 4,000 base IVF is 8 times less expensive than in San Jose. So 8 times 4, that means their basic IVF in San Jose is $32,000. Holy moly. That just was, the national average is around 18 or 16. So we're either 4 times less expensive or 8 times. Please go and get water, doctor. It's okay. We'll wait. Okay. Thank you. That's very sweet of you. I appreciate that. Thank you. I would have to go downstairs, and it's okay. Dr. Mag, what do you recommend for a hostile uterine environment? Hostile. I don't get rid of the hostility. Acupuncture, PRP washes, HCG washes, antimicrobial therapy. Thank you, Peachy Frank. I second that. Everybody wants me to go get water. Sorry I said it. I really just, it just would be too hard for me to do that, and I'd rather keep talking to you. Can we still have IVF with endometriosis? Absolutely. Absolutely. If you haven't joined, everybody join. Vanessa, you really are pushing this. Rachel, look at you guys. Okay, now I'll make the announcement. We really have a CNY fertility member group that really helps each other. So please, and Vanessa, if you wouldn't mind, please don't keep doing this. Please join into each person. That just ties up the questions, and I can't get to it. Melissa, you have known Kiltz for 27 years. How did you meet? In fellowship. He went to UCLA Harbor. I went to UCLA Riverside. Or not Riverside, wherever the hell I did it. The main UCLA campus. And then we shared a class in statistics together. How much does DNA fragmentation affect IVF success? It really doesn't, from my understanding. Can I use my own eggs if my AMH is low? Yes, we can try. Famisha, is it worth to do PGM testing with only 55 CGG repeats? I would have no idea even what you're talking about, Famisha. I would talk to our genetics, to the genetics group at Cooper Genomics. Michelle, okay. Do you do Pixie at CNY instead of ICSI alone? I think Ramesh, we pretty much do ICSI. I don't know what, I actually don't know what Pixie is. Should I move homes before going to IVF or after? Get your eggs, make your embryos. Get your eggs, make your embryos. That is really the best route to go. Get your eggs, make your embryos. Angela, debating PGT testing. Just turned 35, actually. 35 to 40 is the age group that seems to benefit from using PGTA. The rest, it's debatable unless you have a reason for doing it. It's hard to tell you right or wrong. It's perfectly imperfect. If you have tubal blockages, should you move forward with IVF? Absolutely. You want to do it in that case. What is CMY success rate percentage of women over 40 of having a live birth? It has to be less than 5%. How many have I personally seen? Very few. What are the qualifications for Zymot? Just pay money. I don't think there's a qualification. I'm not a big, that's not my, I haven't found enough data to support its generalized use. What's the current wait list for IVF? My understanding is consults are probably July, and then pretty much once you're in the system, keep hopping. But ladies, always put yourself on the waiting list. I just put myself on the waiting list for my sprinklers. So put yourself on a waiting list. When finding an egg donor, does it have to come from someone established with the clinic? No. Or can I use someone I personally know? Yes. As long as they pass whatever protocols. Yes. This is John Tell. Yes. Vanessa, if you could stop doing the individual invites, that would be helpful. How many rounds does it typically take for a successful live birth at 35? About 3 to 4 rounds. There you go, Letitia. I just booked the last month for June. So there you go. Ebony, just had a myomectomy last week. When do you think it's safe to transfer? About 6 weeks. Oh, kisses. Oh, I got some kisses. Not sure why. Do you think skipping a couple of cycles after a blighted ovum would be best, or jump right in? Unique Jump right in. Please jump right in. More kisses. Great. Hello, Caramel Kiss. Maybe that's who gave me kisses. What else is happening here? So, how much is it going to be? I have no idea what your question is. Making Baby McCree. Hello. Any financial questions are not that's not the forum for this. So any financial questions, you can go directly to the financial group at CNY. After hysteroscopy, how long to wait for a transfer? 4 to 6 weeks. Is he talking about transfers or egg retrievals? Both. 4 to 6 weeks. Ramesh, I have done an FET in another clinic, even with a normal embryo and ERA. The embryo does not stick. Should I try a natural modified FET? You should also do acupuncture, serovital, growth hormone. You should see whether or not you have endometriosis and then treat it. Lots of stuff to do, Ramesh. John tells she's a healthy individual, but I hear her use of marijuana would hinder us from using her eggs. Well, of course, because marijuana impacts egg quality, and you don't want to spend a whole bunch of money using eggs that have a lesser quality. So, yeah. Or go to the CNY website. There's a list of costs. Yeah, thank you, Making Baby McCree. Yeah, by the way, and all of our prices are listed on the CNY website. So, okay. What all is done during a laparoscopy? They check to see whether you have endometriosis, uterine scar tissue. They could fix the hydrosalpinx if you want to. How many days after inseminating an egg that is not seen as fertilized in the first day is it not viable for IVF cycle? 1 day. You're welcome. I think you're thanking me. Alyssa, if your levels are right, would you recommend a fresh transfer even though they have a lower? No. Well, Alyssa, it's not a lower success rate using fresh versus frozen. There are particular circumstances where doing a fresh cycle is better than doing a frozen, and doing a frozen cycle is better than a fresh cycle. That's what we're saying. Do you do IVF and how much is it? Rebecca, yes. This is CNY Fertility. We're famous for doing cost-effective IVF, and the prices are on our website. Maria, I'm 42, I have 3 follicles, 2 eggs, 1 fertilized, first IVF. How many do you suggest for age 42? How many cycles? Or, yeah, how many cycles? Probably 3 or 4. Would you rather pizza, burger, or shawarma? Pizza, New York pizza. What's the matter with you? What's the matter with you? I'm from New York, of course. Vanessa, I don't know what to say to you, but if you could stop individually asking everyone to join, that would be super helpful. Vanessa Rodriguez, please. Can marijuana affect sperm quality? Absolutely. 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 Okay. All righty. Vanessa is a robot. Oh, I did not know that. Ellen, how do you stop a robot? I will talk to the team. I just think that's not fair to you guys. If your career, what ratio have you seen of twins, triplets, multiples? Well, in the old days, lots of twins, triplets, multiples. Now, everybody has 1 baby. On average, how many cycles does it take for a successful transfer without PGT testing? I've had 3 so far without success. It's based on age and history. What is a good amount of eggs at retrieval at age 35 is probably, you'd be very pleased to get 12. If you have PCOS, would you recommend fresh or frozen? Frozen. Definitely not a robot. So Vanessa, she's wondering why you're not listening to my request. That's probably why she thought you were a robot. Thank you, Vanessa. No, I want you to, Vanessa, to do it, but just every once in a while, tell people to join, but I don't think you have to tell every person to join. But maybe that helps. I don't know. What do you think about transferring a high-level mosaic? Did I not show? Yes. Last week, I talked about that. Absolutely. You have to understand that there's a lower chance of success, but there is a chance of success. Is 45 too old for IVF? No. Why is a frozen transfer better for PCOS? Because they tend to have thickened uterine lining. They tend to have elevated estrogen, so ovarian hyperstimulation. So it's not optimal. For open myomectomy, how long to wait before transfer? Well, again, it's 6 weeks. Letitia, how many days after retrieval does a fresh transfer take place? It could either be day 3 or day 5, 6, or 7. Is the fresh embryo actually frozen before transfer? Nope. Is it that THC impacts sperm? Yep. If the drugs affect as well as the smoking, so it's both. I'm sold. How do I have you as a doctor? Oh, Ellen. Oh, just CNY Fertility Colorado, if that's where or just you can ask for me and say, listen, I'd like an appointment, but don't do that. See the first doctor you can, because they're all great. You think I can try naturally with an AMH of 0.15? I think, Kia, you have to understand that in your age group, you're losing 10,000 eggs a month, and once you run out of eggs, you don't get any more. What's the chances of a 25-year-old with PCOS and good AMH and egg quality of being successful? About 40%, which is really the highest out there. But yeah, folks, I represent CNY's fertility doctors and nurses and nurse practitioners and financial group. And so, I'm here to show you that we want to answer your questions. We want to make sure you understand what you're doing. Highly recommended nurse practitioner Amy Jensen's for consult that was seen in 2 weeks from referral. Well, Emily, it's not the person. It's just based on how many. It's first come, first serve, and all the patients coming in will be funneled first come, first serve. Is smoking cigarettes bad and they won't do a cycle with me? Well, we will do cycles with people who do smoke, just so you know. It affects the egg quality, affects embryo quality, affects miscarriage rates, even if your partners are smoking and you're not. What situation would you suggest placing 2 embryos? Is if you failed with 1 embryo transfer, you're using day 3 embryos, then and again you failed with one day 3 embryo transfer. Alyssa Vander asked Dr. K to ask me to stop. What? Vanessa, why don't you offline this and contact me directly, at work here, okay? No, I don't want you to stop, Vanessa. I really don't want you to stop. What I want you to do is pace out your recommendations for us to join and do it generic so everybody can join. Is the Valimet transfer beneficial for the procedure, or just allows the patient to relax more? It's actually a smooth muscle relaxant. Oh, guys, please don't worry about this. We're ending the discussion about Vanessa. I apologize. I can sort through it. Please, let's not worry about it. Is mini IVF better for people with PCOS? No. If 4 failed transfers, could a patient transfer 3 blasts? Not likely making baby McCree. Razin, 42 years old. I have 9 frozen untested embryos. Can I transfer 1 each time instead of 2? Absolutely. Ramesh, after the initial nurse practitioner appointment, how long does it take for the egg retrieval? 4 to 6 weeks? No, it's about 4 to 6 weeks for you to get sorted through with the financial and the nurses. And then once you have all the testing done, it's about 4 weeks after that. What are my feelings on weight and success of IVF? This is Christian. I don't have feelings. I think the data supports that, despite your weight, you can certainly be successful. That it shouldn't stop you from getting retrievals or transfers or making a baby. That there is an association with increased miscarriage rates with increased weight, but not significant. That the husband's weight actually affects this more than the wife's weight, which I thought was funny. Okay. Erica, age 36, just had a hysteroscopy to remove polyps and went for diagnostic lab, also to check for endometriosis, had none. Before surgery, AMH was 0.81, and now it's 0.24. Is it possible that will increase? I have 1 blast to transfer next week, but nervous about another retrieval now. Absolutely do the retrieval first. Uteruses don't get older, but eggs and ovaries do. So definitely retrieval. Get as many embryos in the freezer as possible. What is a chance of identical twins? Is there a chance of identical twins in IVF? Yes. Have you seen success with day 3 5 cell? Yes. I'm in New Jersey. I want to freeze my eggs, so contact CNY Fertility, and you can get your eggs retrieved and frozen in New York or Colorado. Do it now, Letitia says to @Rebecca. Angela, if your retrieval or transfer are painful, do they have you take anything? Yes, you can take ibuprofen. Can regular keto be as effective as carnivore keto? Absolutely. Can you share with us how you merged with CNY a few years back and what caused this wonderful merger to happen? Not really, Melissa, because most of the time there's lots of medical questions. So it was just something I had talked to Dr. Kiltz about since 2014. I always felt we had similar philosophies about high quality, affordable fertility care. We had similar philosophies about integrative medicine. I was interested in being part of a larger group. He was interested in opening out the West. So it was love at first sight. How many months of Sterile Vital will produce results? Well, there's not a study, but I think 2 or 3 months would be needed. What did okay, Maria, I am Dr. Magarelli, CNY, Colorado. I'm in Colorado Springs, Colorado, along with Dr. Fink, Randy Fink, who's in Colorado also, Brandis Montez, my nurse practitioner, and 52 other lovely people. I am not in New York City. I am Marisette. I've had 3 failed day 3 transfers. Should I try frozen day 3 or day 5? Day 5 transfer would be better. Do PCOS patients produce a lower quality egg? She's 30 with an egg. Well, they produce more immature eggs, but they also proportionally produce double the number of eggs, so they end up with approximately the same number of mature eggs. How did you end up in Colorado? Are the wild Mustangs still there? There are. Colorado is where my wife wanted to move to. I was working in California, in Newport Beach. I was offered a partnership in a very big clinic there, but you go where your wife is happy at the time. And I'm not longer with that wife, but I'm happy I'm in Colorado. My HCG is 4.5. I was told today that if it doesn't go down, my protocol might change. But at the same time, she told me to start stinking today. So what is stinking? Shana Campbell, I don't know what that is. Stimming, but not stinking. My HCG is 4.5. I was told today that if it doesn't go down, my protocol might change. Yeah, in other words, you might be pregnant. Folly stim, got it. Mara said, my pleasure. Stimming, and not stinking. Stimming, I love it. I think you answered this, but do you recommend low-dose naltrexone? Not really. I don't have a lot of history with it. Theoretically, all of these add-ons can possibly help. And that is the reason we offer them. And specifically, we offer them because a lot of times you folks would like us to do it. Does stress affect the quality of eggs? Not likely. Tito, how high are the probability of frozen embryo transfers working with an embryo? I have embryo transfer Friday with me. Well, it's about a 30, you're 26 years old. It's about a 30% chance. You're very welcome, Ellen Joe. Beth, my blood group is O negative. If I go for donor, should I have to check my donor group? You don't have to, but I would recommend it. Not pregnant, been on 3 months of Lupron since January. Not sure what the question is. Do you prefer to use Menopur or low-dose HCG-LH? Honestly, I use both of them interchangeably. Most times I use the HCG-LH, which is just a stimulation drug, in order to save the folks money. I'm on day 3 of stims. When do you let you know if you want a fresh transfer or not? When we are to go for retrieval? Very new to all of this. Thank you. This is Carly. Just tell them you want a fresh. And if your lab values are appropriate, then you'll get a fresh. If they're not, then you won't. If we start now, would it be possible to have our first round of IVF by fall? Absolutely, Shalise. Absolutely. Can you please discuss when a natural FET is appropriate? I'm actually doing a talk on that, and frozen embryo transfer non-PCOS, the answer is that's when a natural cycle is good, which is a surprise to me. I'm on day 3. Okay, I already said that already. When do you know if you're quality for a fresh transfer? Do they tell before you fly out? No, not really. You can ask for that, but yeah, I think they do, Angela. It depends on your cycle. 29 years old, 0.12, how many eggs and what's the chance of getting pregnant? I think you mean your AMH is 0.12, which is very low. So my suspicion is instead of 30%, probably 20%. Can I proceed with an IVF with the 28 prolactin? I have PCOS. Well, if that's elevated, you shouldn't if you're going to do a fresh transfer. Why do they say freezing on day 3 when you're over 45, Stacy, is because of numbers. Many people feel disappointed if they don't get a transfer, even if it's appropriate that they didn't get a transfer. So they feel disappointed. So freezing and transferring on day 3 at least gives you the opportunity for your uterus to make that choice, not the lab. Does a fresh transfer work for people with PCOS? Of course it does. Of course it does. Absolutely. My cycle started yesterday and we go at baselines tomorrow. I estimate it to end of April or beginning of May. I guess that's a question. AMH is 23. Should I be worried about my egg quality? Nope. But you should be worried about ovarian hyperstimulation. Thank you, Ellen Joe. The man needs water. Water. That's all right. I got about 8 minutes, folks, so I'll be fine. If you're having cramping and just got out of your transfer, drink more fluids. Could it be possible the implantation already just occurred? No, you're just probably dehydrated. We had endometriosis in the past and a hydrosalpinx. The endometriosis was fixed with laparoscopy. The tubes were removed due to hydrosalpinx. Do we need to do Depo-Lupron before FET? That's not a bad idea. I don't think you need to do it. Sarah, I just started Lupron, terrible headaches. Any suggestions? Yeah, call the nurses up. They'll give you a bunch of suggestions on what you can do. Okay, Sarah? It is hard going on Lupron. Folks, if any of you folks have been on the Lupron Depo, usually for endometriosis, if you wouldn't mind giving this lady some hints, that would be great. And that's Sarah Stockton on Facebook and YouTube. I guess I was asking, when would the FET happen? Sorry, I don't know what your original question was. Can I freeze my eggs without my partner? Of course. I mean, of course. Yeah, I'm not quite sure of that question. I keep hearing keto and holistic Chinese medicine routines prepare you for your IVF success. Is that true? Yes. It's low carb eating creates reduced insulin secretion, and elevated insulin secretion is associated with lower outcomes. Traditional Chinese medicine, specifically the Credenda-Magarelli acupuncture protocol or CMAP protocol, as there are other protocols, but that's the easiest to remember and do. And that's associated with increased pregnancy rates, reduced miscarriage rates, much reduced ectopic rates, and live birth rates. And Dr. Diane Credenda and Dr. Stephanie King from East Winds Acupuncture, which I am going to get them online here in a couple of weeks, I guess, and we'll talk to them. And you guys can ask them questions about acupuncture. I think I'll remind myself to do that. But yes, they can help. He just said you're probably dehydrated, Alyssa. Yes. In other words, if you get some cramping during the transfer, you may be dehydrated, and make sure you do bed rest. Priming suggestions for people with no diagnosis at 39, estrogen, growth hormone, serovital acupuncture. And if you need to regulate your cycle, add progestins. But the estrogen causes neovascularization. The growth hormone and serovital are just that. They're growth hormone secretagogues. And the progesterone, as I said, is to make sure you're not going with unopposed estrogen, but you don't necessarily need it. Do you know what the statistics are for women over 45 to have a take-home baby with a donor embryo? Yes, in the 60-70%. That's Jenna. But again, it's the nature of the donor embryo. BCC 914, I haven't started keto and starting stims next week. Do you think it would be beneficial to do it before the egg retrieval? Yes. Alyssa, how long do you recommend bed rest after a transfer? That day and the next day, and then you're good to go. Studies have shown it really doesn't matter, but I like my folks to have at least the day of the transfer and the day after to rest. I mean, if it's 24 hours, then of course you have to get on a plane. I don't recommend running from us to the airport on a plane, get dehydrated, land, stress. Please give yourself at least 24 hours of bed rest. Don't try to leave right after your transfer. Honestly, I don't think that's the best thing for you. I really don't. So I'm going to put my slide up there. We're coming to a close here. I'll put my slide up and explain it one more time because I thought it was cool. So the slide is a recent, it's not published yet, but it's in press, paper looking at follicle sizes from 10 in an IVF cycle from 10 millimeters to 28 millimeters, trying to optimize what is the size follicle that you should trigger at. And triggering is when you hope to get as many eggs as possible. So what they found was you get the optimal number of mature eggs if your follicle size is around 19 to 21. There's no difference in if you get an egg and it's mature. It doesn't matter whether it's from a 10 millimeter follicle or a 28 millimeter. The euploid rate is about the same. However, the chance of getting a good embryo or blastocyst based on the size of the follicle in which that egg was retrieved is linear. So the larger the follicle, the more likely the chance of getting a good quality blastocyst. So this suggests to everybody out there that you want to have your follicle sizes somewhere between 18.5 and 22. That's the sweet spot, 18.5 and 22. Let me put it here, 18.5 and 22. I'll do more. I'll get this out. Change your photo in CNY. Your graphic for follicle size has been changed. My photo. Tell me what that means. Maybe I'll do this. Oh, I don't know if that helps. Be that as it may, folks. This is Dr. Magarelli. I'm going to be signing off here. Thank you so much for. Is the size on the day of trigger? Yes, that's exactly right. It's what if your follicles were that size, but retrieval you had only 4 immature? Then grow them a little bit more, because as you can see, the more you grow them, the more mature you get. So next week, I think might be strictly Q&A next week, not sure. Thank you so much for listening in and sharing your information with me. I greatly appreciate it. I like the questions. That's my pleasure. Again, I'd like to shout out to my nurses, my financial team, my nurse practitioners, my embryologist, my andrologist, my endocrinologist. By the way, please tell the nurses that you appreciate them. If you do, please tell them they're doing a good job no matter where you are. You're so welcome, everybody. Please tell them they are the hardest. They're animals, man. They're working their butts off, and it's a stressful job, and they have to handle so much stuff. So please share that with them. Yes, kisses, everybody. Send me kisses, of course, on Instagram. I love that sort of stuff. We here at CNY Fertility are really out there making access, affordability, and high quality care our mantra. We lead from our hearts. Anna, I'll tell her in Colorado if you have a favorite. I told them today that you guys love them, so that's absolutely fantastic. So thank you for sharing. I'm now going to go get some water, as I promised myself I would. And please take care of yourselves. Avoid alcohol, tobacco, drugs. Stay away from marijuana. Get your COVID vaccine. The data are almost irrefutable, or they are irrefutable. We going to open an office in Seattle? Hell yeah, but who knows when. But anyway, folks, thank you very much. Have a great day. This is Dr. Magarelli, CNY for Colorado, saying goodbye. You guys be well. Thank you.